know exactly when the microphone cut on. We did get a motion to move back into open session. While in executive session, we discussed contractual issues and received personnel recommendations. We will get to the actions for those in just a moment. But first, in accordance with South Carolina Code of Laws 1985, Section 30-4-80-E, the following have been notified of the time, place, and agenda of this meeting: the Fort Mill Sun, the Herald, the Charlotte Observer, CN2, and WRH5. I'd like to ask everybody to please join me for a moment of silence. Thank you. We'll now stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I apologize for the late start. We had to transition from one meeting to another, so it did take a couple minutes, but you've all received a copy of the agenda. Are there any adjustments or corrections? If not, that will stand as approved. All right, we do have a couple actions resulting from our discussions in executive session. So I'll need a couple of motions.
I'd like to make a motion that we accept the recommendation of the administration for one replacement certified position.
We have a motion and a second for one replacement certified position. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? That motion carries.
I'd like to make a motion that we accept the recommendation of the administration to name Darren Wilson as the replacement new principal for Catawba Ridge High School.
Second.
Motion and a second to name Olin Darren Wilson as our new principal for Catawba Ridge High School. Any further discussion? All right. All those in favor signify by saying aye.
Aye.
Any opposed? Congratulations, Darren, if you're watching.
I'd like to make a motion that we accept the recommendation of the administration to terminate a certified position contract.
Second.
Motion is second for a termination of a certified contract. Is there any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? And that motion carries as well.
And I'd like to make a motion that we accept the recommendation of the administration to report that certified contract breach. I don't know how I'm going to say that exactly.
I think it's a report of misconduct.
Yes, report for misconduct.
Second.
Motion is second to report a misconduct to the state. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? And that motion carries. Is that it? I think those were all of our motions from executive session. Do we have any public participation? We do not. Okay. Well, we do have a handful of reports and information that we're going to get. So I will start with 6.01, the Employee Assistance Program. Ms. Liza Garrett.
Good evening. I am pleased to welcome and introduce Mr. Greg Hunter. Mr. Hunter is the Client Development Director with McLaughlin Young EAP. And this school year we're entering our second year, which will be our first full year with McLaughlin Young as our provider for EAP services. So Mr. Greg Hunter is going to come forward and share a little bit of information, including resources that are available for our employees and their immediate family members. And also pleased to recognize too that he is also a member of the community, and we're very glad to have that partnership with a member of our community. So help me welcome Greg Hunter, please.
Thank you. Well, good evening, everybody. I appreciate the opportunity to be here, and thank you, Liza, for that kind intro. You about did it all anyway with everything on the EAP. You do such a great job. So, well, I know my time is about 15 minutes, so I want to get to it. But again, thank you for having me this evening. McLaughlin Young Group, we've been an EAP provider now for almost 34 years. The EAP, we take a lot of pride in the provider network that we have. We have 40,000 providers globally. We're headquartered in Charlotte, right near South Park Mall. It is key to know that we are an independent provider, which means we are not affiliated with any insurance companies or anything. So what's really good about that is any diagnosis, anything stays with us, people can feel comfortable. Our network stays ours, so if anyone does ever use the EAP and they want to use it again and they've established that relationship, it doesn't matter what insurance changes or happens, it's really a kind of a key component. One of the things that people like a lot about our program is that it's our network and we get to keep it intact. 24/7, 365 is an important feature of our EAP. We don't have a call center or anything. We actually have clinicians that answer those calls. It's really important so for that in-the-moment support as well as any crises or anything like that. So we're very pleased to have that 24/7, 365. Very important to us is the credentialing. We make sure that we have the highest credentialing in the industry, which requires 5 years experience of our providers in our network. They must have a licensure, and they must have a master's or a doctorate. So no interns, no bachelor's degree, none of that. Nothing wrong with that at all. It's just we want to provide the best in our network to support you and your family members, okay? So, and again, with 34 years experience, we know what's in the community and how to connect people, and that's a value add that we bring to the table. The EAP, again, Fort Mill School District provides this for employees and their household family members. It's free. It is confidential. That is a very critical point, that it is confidential. We want people to feel, look, it is first and foremost in our hearts and in our kind of mission is to make sure we've never had a breach. Everything is HIPAA compliant, so people know when they call. It's very important. It's key to the success of this program. Again, I mentioned employees and household family members are able to use this benefit. I have college-age students up there as well, just because we know our sons and daughters go off to school, and we want them to have access regardless of where they are in the globe. Like I said, we're global providers. So, telephonic, face-to-face, and video counseling is available. We were in a great position when this pandemic hit because we already had virtual counseling in place, so it was a very seamless transition. And I anticipate after the COVID that will probably be something that is more utilized than we've ever seen in the past. Typically it's 99% face-to-face, but I think we will see more of that. At least all indicators show that. We're actually seeing face-to-face or virtual right now or telephonic, and people are still opting for that virtual experience. Again, we can connect to local providers as well as other resources in the community. So what is the EAP and what isn't it? So EAP is really about, again, it's sponsored by Fort Mill School District in this case and any of our partners for their employees. It is assessment focused. It's very, it's not a long-term solution. It's there as a short-term solution focused benefit for people to take advantage of. What we're not, as I said, we're not an EAP, we're not long-term care, and we're not a coverage that kind of is a stopgap. That's really important because we don't ever want to disrupt the continuity of care with somebody. So, obviously, if there's any questions, feel free to ask at any time. Otherwise, I'm going to try to hit that 15 minutes for you. I won't read all of these, but these are most of the reasons, a lot of the reasons that people do access. You can see it ranges from the family dynamics to stress to the work dynamic. Obviously, substance abuse is big. Right now, suicidal ideation is not up there, but unfortunately, we're seeing a ton of suicidal ideation. So we're very equipped to handle all of these different issues. Loss and grief, as you can imagine, has been significant this year because we have, as I said, partners all across the U.S., including some of the hot spots and different things that we've had. You know, we've done a lot. It's not up on this slide, but we've done a lot over this period of time to get out information in support of COVID and the civil unrest and everything as well. So it's not just the EAP, but we also bring value to our partnership with you by providing a ton of information that hopefully can help people navigate through this and be resilient and help cope with these different crises. What is the cost? Again, we talked about it. There is no cost. The benefit includes up to 3 sessions per issue, per person, per year. So it is very robust. We want to make sure that people understand that it's there, because what we don't want is somebody feeling like, oh, we've got 3 sessions, let me just figure out how to well, this isn't maybe as critical, maybe I'll save those for later in the year in case something happens. We don't want that. So we offer it per issue, per person, per year. You actually have, as part of the benefit, all the manager resources, and that's why that's up there. As far as if there's ever a formal, you would actually have 6 sessions for that, okay? So any costs incurred through a referral to insurance or whatnot, you know, is the responsibility of the individual. I will say that when we make those connections up front, we're trying to make sure that everybody is connected to someone in the insurance that you have in place. Can't 100% guarantee just because it could be a unique situation, but it usually happens, and that's always our intent. So that if it does go beyond the 3 sessions, it's an easy transition into that. Confidentiality, I'm a licensed professional counselor as well, so I have to do a quick synopsis of confidentiality just by law anytime we're talking about this, as well as I want you to feel comfortable with the confidentiality that we have in place. If someone comes into counseling and they are at risk of harming themselves or someone else, we have to violate that confidentiality. It's called informed consent too. If anybody ever's been to counseling, no raising hands. That's not what I'm asking. But if anybody's ever been, you know, informed consent is there, and if somebody ever asked you, we would go over this, obviously. The other thing is that sometimes in a family dynamic or a home dynamic, throughout the course of counseling, we may find out that children or adults who cannot take care of themselves, maybe the elderly or whatnot, we have to advocate for them as well and call Child Protective Services, you know, police, Adult Protective Services, whomever necessary to make sure and ensure that people are safe. Okay? So how do you access services? Again, 24/7, 365 is the theme because we want people to know that we're always there for in the moment or just setting up appointments. For anyone who calls, household family members, employees, etc., you have daytime and evening, and we even have some weekend times available too. We do have providers in our network that will offer that. The appointments are typically in 3 to 5 business days, and that's for the norm. Just, hey, you know, I've got some workplace stress or something, I'd like to talk with somebody. Our average is around 3 days, 3.1 days, 3.2 days, something like that this year. But that's the goal. If it's urgent but not life-threatening, it's 48 hours or less, often less. And then obviously if it is life-threatening, we are going to react immediately. We can get mobile crisis units out, etc. Our goal is to be there and support. Work-life resources, which is another piece of our EAP program I'll talk about in just a moment. But again, that is about 2 to 3 days, and that's really what we're talking about there is the legal and the financial components of the work-life benefit, which you've enhanced this year too, by the way, which is great. And then the 800 number is there, 704 number as well. If you've seen our wallet cards and brochures and posters, it has all that information on there as well. So what is the work-life services? Everything I've talked about thus far has been counseling. It's going and sitting, life's throwing you a curve, and it's important that you get help. It's important too that you know, a lot of you in leadership roles are going to have either, you know, sight to somebody who's struggling, or somebody comes to you in a leadership role and says, hey, I'm struggling, and you, by being aware of this resource, can help them get there. One key thing that I always share is just remember, this is about life skill development, right? What we do is about life skill development, and if you use that term even, it tears the wall down. We're not psychoanalyzing, we're not hypnotizing, you know, and finding out what happened at 3 years old, et cetera, and going from there. It's solution focused. We're going to take your strengths, find out your weaknesses, identify your support systems, and really help you get there. Because if you haven't been modeled it or experienced it in life, chances are that skill set's not in place. But yet we hold ourselves to that type of accountability all the time. If I've never been through a divorce and I'm going through it and I'm struggling, what do I say to myself? Oh, I should be handling this better. I should be doing that. But it's not fair to ourselves. And a lot of times people don't seek counseling and support because of that negative self-talk and that kind of barrier that we put on ourselves. But the reality is not a person in here would disagree that we don't learn through modeling and experience. So if that hasn't occurred, or the modeling's been poor, then all counseling's do is help you develop those skill sets. So it's important to remember that. So any questions? All right. As a transition to work-life resources, you guys have a username and password to access. It's on www.mygroup.com. If you want to take a picture or write it down, go ahead. It's on the information that we have as well. But FMSD4, username, yes, password. This is a picture of the webpage. It's tough to see, I know, but basically in that dark blue are the kind of umbrella topics: parenting, aging, working, living, thriving, balancing, international, etc. So those categories all have subcategories, and those are where our articles are. and different things. I'll get to that in a second. You can see very easy to maneuver. The big box under the dark blue is a monthly topic or a topic that we have consistently on there. We have online trainings. You can see online seminars and e-learning are there. There's 77 online trainings at no charge, all with certificates of completion. We have the center, so you can access anything from a savings center to get discounts on clothing, jewelry, travel, entertainment, things along those lines. A great resource. A lot of legal documents on here, so you can do a will, power of attorney, bill of sale, etc. We have a news for you section, so whether it's a hurricane, tornado, mudslide, coronavirus, opioid, suicide, we will have news up there that is current and accessible for everybody to access. Throughout that website are over 11,000 articles. I talked about the webinars. The will generator, again, you can do a will. It's the most popular piece of the work life is to be able to do that. Most people don't have one. Relocation center, it's like a virtual welcome wagon. It tells you everything about a community. You type in a zip code, it tells you everything. Searchable databases are great. You can find daycare, elder care, pet care, volunteer opportunities, adoption agencies, et cetera, et cetera. A lot more gym memberships. There's just a ton of different information on there that you can seek out through the website by just going in and typing a zip code and radius. So I talked about counseling, talked about the website, and now there's two other components, the legal and the financial. This is, legal is either face-to-face, telephonic, it's advice that you can get, 30-minute free consultation, unlimited number of issues per year. And in most cases beyond that, if you had to go beyond 30 minutes, you get a discount. Legal forms I talked about. Financial services, anything from debt management all the way down to I can't balance a checkbook, anything along those lines, you're able to reach out and talk with a specialist that can help you. There's bankruptcy prevention, there's credit monitoring through our partnership with Credit Karma, et cetera, et cetera. You can see just a wealth of information to take. Neither of these affect the 3 sessions that I talked about with counseling. They're all mutually exclusive. These two are mutually exclusive of each other as well. So again, in the moment counseling, short term, unlimited number of issues, telephonic, face-to-face, or virtual, web-based and telephonic for the EAP, for the work life, and your legal and financial services as well. So I think I did it in 15 minutes. I feel like an auctioneer. Any questions? Did it hit everything? Positive, get it?
Do we keep, or do we have the ability to know how many of our employees are accessing and using this benefit?
We do. We provide a quarterly utilization report that comes out, I guess April, every quarter. So April, August, October, and then into January for the end of the year. You guys have excellent utilization. It's grown each quarter. I checked that before we got here. You guys just continue to improve on that utilization. So just getting the word out, marketing, using our promotional materials will keep getting that number up. This year's been an intriguing one, as you can imagine, with everything we faced. So
that was going to be my question. I'm just curious how well it is known about in our staff and employee community, and is the usage up given some stress that people might have on their plates right now?
Yeah, like I said, your utilization is really good. It's about 50% higher than the national average. So that'll tell you that folks are using it and it continues to grow.
Or that we are stressing everybody out.
Well, you know, this has been a fascinating year, okay? Because if you watch the media and you watch everything as it started, right, with the pandemic, you heard a lot of people saying there's going to be this deluge, it's going to be an onslaught of people to counseling. Us in the field said, time out, it's going to happen, but it's not going to happen right away. Because think of Maslow's hierarchy of needs. We all probably have been exposed to it. Food, safety, shelter are the basics. Well, when this pandemic started, what happened? People were on furlough. All of a sudden, we're teaching our kids at school, schoolwork at home. We may be working from home. So we had all of this kind of upheaval that we had to really kind of settle and get into it. We also thought, this will be 3 months, 4 months. Okay? I saw a curve today. It was fascinating, the depression curve. And if you watch it over time, we're not there yet. Believe it or not, if this continues, you're going to see that go. And and we're almost plateaued, and you can see it'll start kind of plateauing and work its way back. But the timeline is further out than I think people really realize. So we're seeing, June was where we really saw the uptick. We didn't see an uptick really in March, not in April, and not in May. But June, when there was the announcement of second phase coming back, like, starting to come back, in combination with the civil unrest really starting right then, we saw anxiety go through the roof. And that's really where we saw the uptick. July came back down just a little. Summer months, it's normal. August up, September up, and I have no doubt that October will be up a little bit as well. So I know it's a longer answer, but it's hopefully it kind of gives you a good feel that you guys are really on track. Like I said, you're 50% higher, a little bit more than 50% higher than what the normal average would be. So great job. Just keep promoting. Any other questions?
Any questions? Anything else, Liza?
Thank you so much for your time.
Thank
I hope
you.
I didn't
Thanks for
take
the
up too
service.
much, but I
Glad to have
appreciate
it.
it. We love your partnership. Thank you.
Thank you.
All right, so very glad we have that right now. Item 6.02, an update on the CARES money.
Yes, so good evening. So my original plan tonight was to give you an update on 3 different state surveys that we responded to over the last 2 weeks. The State Department's had us running around in a lot of circles on these 3 surveys. And the 3 surveys were related to technology reimbursement, opportunity, PPE reimbursement, and the third one was related to other supplemental services. And we had submitted a request for some aid going towards some of our virtual academy costs. Monday morning, Molly Spearman had a call with the district's superintendents across the state, and I listened in, and that call completely changed the plan. Basically now the state, instead of reviewing all the data that was submitted by districts for a reimbursement type model, they are going to allocate these funds under what they call a direct allocation. So we are regrouping on that. I mean, a lot of the work that we did and the cost, we will also hopefully receive enough to cover a majority. On the call, no, these funds are coming from the state's $2 billion CARES Act. And of that pot of money that the state was controlling, there is approximately $80 million that they have left that they are using to reallocate to districts under this methodology. And the allocation will be based on pupil count with the poverty index. So as you know, we're the lowest free and reduced district in the state. So for that reason, that piece will not help us. She did indicate that the range of allocations were as low as under $10,000 to as high as $7.5 million. So we will fall in that range somewhere. We just do not know. We've been watching our emails to see. We're supposed to have received that this afternoon. We have not received that yet, our actual amount. But just to kind of give you a recap of, and the items that this can be used for are the same items as the 3 surveys: technology, PPE, and other supplemental services. But to give you an idea of where our district stands and what we have previously submitted, the PPE, of course, was the largest amount. And our total to date that we had spent and we submitted was $778,961. $778,961, which covered all of the items such as the face mask, the desk shields, the hand sanitizer, the wipes, the water bottle stations, the mister machines, the signage. All of those items fell within that category. The technology that we had planned to claim related to COVID-19 total $274,099. That was our items such as the T-Mobile hotspots, the Google Enterprise for Education, the ClassLink, a lot of the items that we had on the original CARES Act money grant that we got. We were told we could shift it over to this and free that up. And then for the virtual academy, the total we had submitted was $179,000. So all three together, we had submitted a request for $1,232,000. So we will see what our allocation, and we will let you know as soon as we know what our allocation is under this new direct model that they had decided to send us.
And that 1.2-ish is not everything we've spent, that's just what we felt like we could request from this particular funding source.
Correct, but we have been pretty careful about, we have been tracking everything in a separate fund. So it was either tracked as part of the original CARES Act allocation that we received, or the additional funds that you allocated from remaining funds last year to help us with our plan, not knowing if any state money was going to be available. So I feel like that's a pretty good indication of what we've spent this, plus we've spent that CARES Act, that $633,000. There's a few items that overlap, but
So
that's in the range of what we have
we're
spent.
bumping up against 2 million in total of
Correct.
expenses related to the pandemic, it sounds
Correct.
like.
And we're starting to get requests now from the schools as they're going through some of the cleaning supplies. They're requesting additional cleaning supplies. We feel like that's going to be ongoing throughout the school year. So we're hopeful that the funding that does come from the state will help replenish some of these dollars. So then we will have funds to continue with some of the needed cleaning supplies.
And I'm drawing a blank, I can't remember, I read something, I want to say 32 million, but maybe that was from the private school lawsuit. There was some amount that Molly had said she had ordered additional masks.
So the other piece is, and I'm not sure if it's 32 million, but the other piece is, I think I shared with you at the last meeting, the state procurement office sent a request, or sent a survey request to all the districts that allowed us to select from items that they had negotiated contracts with certain vendors. And the state covered it out of their portion of the $2 billion CARES Act. So we are also receiving items such as desk shields, additional cleaning supplies. We purchased an additional Mister machine for all of the schools. Those items are coming. Some are already here, some are still on order. Those items are coming from the state under the state funding. So those are not,
So we
that's a great
didn't spend money on
We
them.
did not spend money, those are not included in my totals
Ms.
as
Clark,
well.
sorry.
Yes.
I remember you talking last time, I want to say it was a half a truck or a truck of wipes. That's something I'm hearing, especially teachers saying wipes, especially at the elementary school. I can only imagine. So, can you remind us what we received as far as those disinfecting wipes?
We received 13 pallets
Okay,
recently. That was our second order. We ordered some on our own when the year began, because that was before we had any idea the state was going to fund some cleaning supplies. But under the most recent state procurement office survey, we requested additional wipes, and we have received those.
13 pounds.
Yes.
How long do you think that'll last?
Uh,
No.
that is the question right now, and we're starting to get a little bit of a
I
feel.
needed some.
Yeah, we're starting to get a little bit of a feel as far as kind of how quickly we're going through this inventory of supplies.
Yeah, so I was specifically, having conversations. What do you need in your classroom? Wipes,
Yeah.
gloves. It seems like gloves are at a premium as well.
And we requested additional gloves
Fantastic.
on the survey. So Kelly Keniston, who's our district procurement officer, she's keeping very close contact with our schools. And we're working through all those requests as we receive them.
Thanks for staying on top of it.
Yes,
I know.
absolutely. But we are trying to encourage our schools that it's not an endless supply. So we're trying to make it last as long as we can. But we're certainly going to provide what the schools need this year in regards to cleaning supplies. But we will, as soon as we know, I am anxiously waiting on what our allocation is. We will let you know, and then at the next meeting, I'll kind of let you know what we ended up or what our recommendation as far as shifting this around. So,
Before you leave,
Sure.
anything new on the impact fee lawsuit?
no information,
What date?
no new information on the impact fee over the last 2 weeks, so,
Okay.
yes.
Anything else from Ms. Lord? All right,
Okay,
thank you
thank
very
you.
much. 6.03, in case anybody's wondering how things are going with school.
Yeah, okay. Like to make a couple of big picture comments and then some more comments with some more specifics. But as you know, or you may not know, we have our elementary grades now going in the K-5 face-to-face Monday through Friday. We have the middle and high school grades in hybrid HAB schedule. We declared, and the elementary started on September 28th, I believe it was. We went the first 4 weeks of a hybrid. We said then, when we initiated our plan, that we would review the plan every grading period. So we're reviewing it, we continue to review it for the first grading period, which I think is going to be up in 2 weeks. So, I mean, we're not going to be recommending any changes to our plan between now and November, whenever that day is, the end of the 9 weeks. We'll continue to evaluate. I will say that big picture wise, we intend, in all caps, and this would be assuming that the virus rate is not too high. We plan to go back at the continue at the elementary level in the face-to-face 5-day. We plan to go back at the high and middle schools at the end of the first semester, starting at the second semester. Now, it may happen sooner, but we want to go ahead and announce that tonight, so those kids, specifically the high school kids who have to re-register for the second semester on the virtual academy, we have some kids who may want to change their status there, and I'm going to read a little specifics about that. But so I want to go ahead and get out in front of that. Now, that doesn't mean, if we go through this flu season or this viral season and York County unfortunately just switched back to a high category, which is kind of the first thing we have to look at when making the data-driven decision about when to return, not whether to return, but when to return. That's going to drive everything, but this is our intention. So we say that for those students as they're making those decisions going into the second semester. So let me just read so I can get all this right. All high school students will be asked to choose face-to-face instruction or FMBA for second semester. This re-registration window will run from October 23rd through November 6th, 2020. As I stated, our goal for second semester is face-to-face instruction with all students attending school 5 days a week. Of course, this can always change based on the health situation. One of the major concerns from parents this semester was overlapping classes. This registration deadline will give us the needed time to reschedule the second semester. This will allow us to significantly reduce the number of overlapping classes. In order to do this, 4 Mill Virtual Academy students will be scheduled with teachers from all 3 high schools. This will allow us to reach our goal of significantly reducing overlapping classes. I don't get into some details, but if you're a high school student, you understand these details. It is also important to know that once a high school student declares their intent for the second semester, they must remain in the model for the entire semester. We will not be able to allow students to move from face-to-face to FMBA or vice versa after they complete the registration form. Again, all those rules are based on staffing. So that's kind of where we are as we check the temperature here on October the 20th. As I said, we'll continue to evaluate for any earlier returns. The York County, again, I'll reiterate last week, they went back in the high category, which is troubling. But that we were hopeful that everybody does what they're supposed to out in the community, that we get this thing back down again to the middle or lower category. And really, short of any specific questions, that's kind of what I was wanting to announce to the public tonight. The board knows we're looking at challenges associated with going back before January, the end of January. And they're all related, they're issues with staffing, related arts, special ed needs. We can fix a lot of things easier in January than we can now. So that's just a kind of a teaser. I can try to, me and the staff can try to answer questions, but for the public's sake, that's kind of the big picture and a little bit about the specifics. Questions or comments?
So our dashboard continues to come out on Fridays. I'm sorry.
I'm sorry.
Or were you talking to? I can't hear.
No, you were talking.
Difference coming from directly. The dashboard continues to come out on Fridays. I noticed, I'm sure everybody else noticed, you know, the case numbers didn't change dramatically, a couple more here, a couple less there. I did notice the quarantines are up, and one of the things that you and I have talked about is that at whatever point we go back to 5 days, just like what's happening in elementary right now, when you have more kids in a classroom and you have a case, it necessitates a greater number of students being quarantined. I don't know, to a tune of 6 or 8 magnitude, right? Because instead of one student who doesn't have anybody within 6 feet, you've now got a student that's got, you know, a handful of people within 6 feet that by DHEC regulations. And so I suspect that's part of what we see in some of our quarantines here with elementary now being in 5 days.
And in that regard, I think another mitigating approach we'll take is to, and we talked about it earlier, is to order the shields, the desk shields for middle and high. And we're working on that where we could reduce the definition for
The close contact.
close contact, all these terms,
quarantine.
from 6 feet to 3 feet. So that would help us at the high and middle. But you could make a good case, I think, for the reason we've had the low numbers that you talked about, at least not the quarantine numbers, but well, even the quarantines to some degree, is because the plan has been solid up to this point and you've had the family model. It's a little different situation. That's why when you go high and middle without the family, so that's why we're trying to make it safer.
And then you had mentioned last time, certainly it won't be a knee-jerk decision to move. If anything, if things improve and we're able to go sooner, there'll be plenty of notice. But as of right now, at a minimum, we're hoping everybody can be back, barring something crazy over Christmas or whatever, first of the year.
Putting the flag in the ground and praying that happens.
But to be clear, that is still for those who are in person today, and the switch to and from virtual is still expected for the full year, and only exceptions on a truly exceptional needs basis, right?
We'd love to be more mobile in that regard, but when you talk about staff, you just can't.
Okay.
We're trying to get kids back. We know it's better when kids are back. So that's our goal. That's our intent. That's the whole initiative. That's the whole reason for this, everything we're talking about.
Questions? The only other thing I would mention, because I believe, and I was talking to somebody in the community, and they were surprised but when we started talking about this, I think that regardless of virus aside, and let's hope that there's a vaccine and the spread is down tremendously and all looks great for next school year, is it a true statement that it is at least a consideration that we would still have a virtual option for next year?
I think that's a true statement. I would venture to say it's a certainty. The number of kids that would sign up for it, I believe, is the big question mark, and that's what we've got to determine. And we'll get this read on the second semester soon, but really going forward, that'll be the $64,000 question for next year's planning.
Well, and whether it looks the same as this year or it looks slightly different.
Yeah.
Okay.
I would anticipate if a vaccine emerges, we won't have as high a number, a 30% number
Sure.
being virtual. That would be my guess.
But at some point in the spring or the summer when we do registration or something like that, I would assume that would be when we would give parents the option to select those kinds of things. I'm getting nods, okay.
Yes.
I think it's important for people to at least be thinking about that,
Yes.
you know.
And I want them to plan for January. you know, that's why I said what I said.
Right.
Well, and with that plan, pertaining to related arts, we're still offering across the board, as we always have, provided, as has always been the case, that we have enough students sign up for, and or not too many sign up for, that we have to say, no, that class is full.
That's what's made this more challenging. We've got a robust related arts. We tried to make the schedule the same as if we were here 5 days. And that caused some issues that we're dealing with right now. It's not as easy to flip because of it. That's one reason.
And the same will be true for the high school for the second semester, is which courses, how many people can be in them, assuming that it's a full five-day in-person kind of instruction. All right. That concludes what was on the agenda. We actually did not get finished, that's why we were running late. We have a couple things that we still need to finish up in executive session, so I'm gonna ask for a motion to go back into executive session to wrap up our discussion on contractual issues and personnel recommendations.
Motion to go back into executive session.
Second.
Okay, well, thank you everybody for joining. We are gonna move into executive session for a few minutes and then come back and close out, but, hope everybody has a great week. Thank you. We can stay in here.